Good evening, everyone, and thank you for joining us tonight. My name is Tanya Pintado, and I am a certified wound and ostomy care nurse here at University of Miami Hospital. It is with great pleasure to be your host for tonight's support group. However, before I introduce tonight's speaker, I do want to take the time and mention that during this session, you will have the opportunity to type and submit your questions in the Q&A box located at the bottom of the screen. You will also have the opportunity to select the Raise Your Hand feature, also located at the bottom of the screen. This feature gives you the opportunity to ask questions as well. We will get to the questions at the end of the presentation. Now, allow me to introduce to you tonight's speaker. Dr. Jose Miguel Minguer Rodriguez is a graduate of the School of Gynecology and Obstetrics from the National University of Mexico Hospital, Luis Castelazo Ayala. He has 11 years of experience in general gynecology and obstetrics and a specialization in minimally invasive gynecology. Dr. Minguer has 14 years of experience in clinical education and health promotion. In addition, he has worked on developing sales manuals provided for doctors and paramedics. From 2013 through 2015, he served as an assistant medical professor, facilitating the learning process of gynecology and obstetrics students. He has numerous certifications, one of those being an ostomy care associate, which is a very impressive professional experience. So I will let you take it from here.
Thank you, Tanya. Good evening, everybody. Thank you to the Miami University Hospital for receiving me on this session. It's a pleasure for me to be speaking to you. For you to know, I'm placed in Mexico City. I'm a Spanish speaker, but I will try my best to talk to you in English, and let's be sure that I can solve most of your questions. So today we will be talking about peristomal skin health. This is, Tanya, sorry, can you help me to allow me to share my screen, please? Thank you. So we're going to be talking about peristomal skin health. Tanya, can you confirm me that you can see my screen? Yep. Perfect.
Yes, I can see your screen. It looks
perfect. So why is the peristomal skin health important in the management of an ostomate, of an ostomy patient? Because specifically the skin of the patient, of the ostomy patient, is the only thing that doesn't know what to do there. So the bowel that will be turned into a stoma, the function of the bowel, it will be the same function as it was before. Maybe it will be externalized before the usual end of our bowel, but the bowel is the same. And the only thing that is new on this story is your skin, and specifically the abdominal skin. It's a pretty specific skin that needs to be taken care under this ostomy situation. So all the stomas come in different shapes and sizes. Most of them, and hopefully, are a round stoma, a circle stoma. Most of them hopefully will be a pretty good high stoma with maybe 1 inch of height, and this height will be easy for you to manage your output, your effluent. But most of them are not a round stoma. Some of them are oval, and some of them are flat stoma. And the size of the stoma, maybe it's going to be a little stoma, but some of them will be big stomas, more than 2 or 3 inches of size. The skin around the stoma, this peristomal skin, should be intact, and this condition, the intact condition, should remain all the time that you are an ostomy patient or a stoma patient. So this skin needs to be without redness, needs to be without open skin, needs to be without irritation. And for you to know, the irritation, the peristomal skin irritation, is the most common peristomal skin complication that we have on our ostomy patients. And it happens all over the world. We have statistics from all over the world that this is happening. And the reason why is because this skin, the abdominal skin, is not used to be in contact with this kind of effluent, with this kind of liquid, with this kind of stool. And this stool, this liquid, can be very harmful for the skin. So the skin also acts like the permission to the skin barrier to adhere to the abdomen. Remember that the skin barrier is this part of your ostomy appliance that needs to attach to the skin and will hold the pouch that will hold the effluent from coming out from your stomach. So as you can see on the image on your screen, the skin around the stomach, the peristomal skin, should remain intact without redness, without irritation, and the stomach needs to look like specifically the one that you have on your screen. The stomach needs to be red, needs to be warm, and needs to be moist. If your stomach starts to feel like dry, or starts to change in color, starts to turn purple, or maybe black, that hopefully won't happen ever, then you need to contact immediately your WOCN on your ostomy clinic to be evaluated by the healthcare professional. Remember that Hollister have secure start services in the United States. These services help you as an ostomy patient to have pretty good information, not related with the brand, with the Hollister brand, just good information for you as an ostomy patient, and giving this contact that we have in Hollister Secure Start with the patients, we can make them some service, and we can ask them to participate with us with service. And in one of those surveys back in 2015, these surveys were completed by more than 200 people with an ostomy, and 92% of them experienced some type of skin barrier leakage. That is the most common problem that the ostomy patients have. 84% of them experience peristomal skin irritation. We will further in this presentation look how this skin irritation is produced. 66% would like to have more information on why skin irritation occurs. And this 66% is the one that concerns me more than the 92% or the 84%. And why is that? What is a concern for me? Because this means, this 66% means that 34% of the ostomy patients are used to have maybe a peristomal skin irritation or a skin barrier leakage, and they do not know that this is a problem. And if they don't know that this is a problem, they won't look a solution for this problem. So it's for you to know that the leakage is not a good thing to have, and it shouldn't be happening under your skin barrier. And the skin irritation is not a good thing to have, and it's also preventable, and it's not good to have this kind of irritation. So let's look a little about the skin functions. The skin is the largest organ on the human body. The skin has a lot of functions, not just is what we look on each of us. It's also our first barrier. It's our first defense. Is the organ that allows us to have interaction with the environment, is the organ that allows us to have interaction with each other. So this interaction depends on this capacity, on this function of barrier of the skin. This gives us protection, and this gives us our first defense immunity. It also has thermoregulation functions and isolation functions that are not specific for the abdominal part of the skin, but it's good to know that the thermoregulation and isolation functions of the skin are one of the most important of it. The sensitive perception is one of the most important for the skin, is the one that helps us to have interaction with the environment, and also has some vitamin D synthesis functions. On the barrier function and immunity, this skin acts like a wall built by bricks and mortar, and the bricks being these epidermal cells of the outer layer of our skin, and the mortar on our skin is this specific and highly specialized lipids that act bonding these epidermal cells, and these built as a wall help us to bring the barrier function. And this barrier function takes the bacteria out of our organism, out of our body, and keeps the good moisture quantity on our skin and on our organism. So it's important to have this natural skin barrier function intact. And because of the abdominal skin on the ostomy patient is at risk because it's in contact with an effluent that can be very corrosive, then this moisture can be lost if the barrier is broken, and also the bacteria and the dirty things from the environment can get inside our organism because these break up on our barrier function. So it's important to have this barrier function intact on the ostomy patient. The other part of this history, one part is the peristomal skin, and the other part is the effluent coming from the gastrointestinal journey. So the gastrointestinal journey, specific the pH of this effluent, of this liquid, of this stool, is pretty important to understand why is inside this effluent, to know that the skin is at high risk if it's in contact constantly with this effluent. So this effluent is full of digestive enzymes. These digestive enzymes come mainly from the pancreas. Let me look how to annotate. Mainly from the pancreas that I will be surrounded here. This pancreas and the liver secretes pretty alkaline substances into the gastrointestinal journey, and these alkaline substances fight against the acidity of our skin. The pH of our skin is an acidic pH, so it's a pH between 4.5 and 6.5, and the liquid, the stool, the content of this gastrointestinal journey here at the column or here at the enterum can be a pH from 8 to 8.5. So it's pretty alkaline to our skin. So this alkalinity of this liquid, of this substance, is pretty aggressive against our skin. Of course, our skin, our first defense skin is fighting against this alkalinity, but in some time it will lose because it's too much alkalinity against the acidity of our skin. So it's not just the alkalinity of the effluent, but it's also these digestive enzymes, the ones that are in charge of destructing the skin barrier function of our skin. These digestive enzymes are amylases, that these amylases breaks up carbohydrates that are on our skin cells, proteases that breaks down proteins also from our skin cells, and also lipases that are this mortar, this cement that is bonding our skin cells between. So this content, this high content on digestive enzymes is the responsible of the skin irritation around the peristomal, the peristomal skin. So the regular function of these amylases, proteases, and lipases is just to break down and decompose the food that we are eating, that we are taking, and make a small part of nutrients for us to be able to bring into our system. Their function is not just is not intended to be to break your skin, but if you take these digestive enzymes over your skin on a leakage down the skin barrier, then you will have skin irritation because of these substances. So these substances, if you have a different pH for them to be on, like the pH on the skin barriers of your pouching systems, then these enzymes can be inactivated and then will no longer hurt your skin. The effluent, as I told you before, the effluent full with digestive enzymes, with these proteases, with these lipases, and the epidermal cells full of proteins bound through phospholipids will be broken up and will be the perfect food for proteases and lipases. So what we need is a barrier here to prevent this effluent to touch your skin. But also you need that this barrier, that this skin barrier that is touching your skin, preventing to be hurt by these enzymes and this alkaline liquid, you need that this skin barrier won't be harmful for your skin. You need that this skin barrier has a pretty good science before the manufacturing of this skin barrier to be sure that not just the touch of this skin barrier will hurt your skin. So this is why you need a pretty good formulation on the skin barrier. And also you need a good fit surrounding your stomach to prevent the leakage, and that the leakage will bring you harmful for your skin. This skin irritation around your stomach is called peristomal skin complications. If we want to know how often are these peristomal skin complications happening on ostomy patients, we just need to look for the statistics on the medical literature, and we will find out that maybe 7 or 8 of each 10 ostomy patients will experience or have experienced peristomal skin complications. So it's a pretty high percentage of patients suffering from these peristomal skin complications. So there is a pretty good chance for us to help you preventing these peristomal skin complications. And of course, we have the tools, the necessary tools from the clinical point of view to help you to prevent these complications and the effects of these peristomal skin complications. Which effects? Specifically, the clinical effects. You can have irritation, redness, broken skin, maybe pain, maybe bleeding, maybe itching. Those are clinical outcomes that we do not want you to have. Also, you can experience a low health utility. Health utility is a way of that we have on medical science to evaluate the quality of life on health-related issues. So the health utility on patients with peristomal skin complications is lower than the health utility and the quality of life on those ostomy patients that are not experiencing peristomal skin complications. And finally, the economic burden, the amount of money that you are spending on taking care of your peristomal skin complications, of course, will be higher if you're experiencing a peristomal skin complication than if you have a pretty good health peristomal skin. So the final formula and the ideal formula for us to bring you to prevent peristomal skin complications and have a pretty good and healthy peristomal skin is have a good fit of the pouching system around your stomach and have a good formulation on the skin barrier that is bonding your pouching system to your skin. So a good formulation with a good fit will bring you a healthy peristomal skin. Of course, to have a good fit and good formulation, you need a good medical advisory, a good clinical advisory from your WOCNs or your healthcare professionals in charge of your ostomy. So this is the way how we are gaining a healthy peristomal skin and also educating us as a healthcare professionals and also educating you as an ostomy patient and knowing that it's not good to have skin irritation, that is not normal to have skin irritation, is not normal to have peristomal itching, is not normal to have peristomal skin bleeding. So if you know that that is not good to have, you will reach out advisory and clinical advisory with your WOCN, and we will be able to help you to prevent these complications or take care of those complications, solve them, and then be sure that we will remain with a healthy peristomal skin. So causes and management of the skin irritation. I told you before that the skin irritation is this broken, irritated skin. It's usually caused by one of these problems. I already told you some of them. The leakage of the stoma output onto the skin underneath your barrier. If you don't have a good fit surrounding your stoma, then you will have leakage, and this leakage will irritate your skin. Improperly sized skin barrier opening. If you have a pretty tight opening, then you won't have a good adherence of the skin barrier. And if you have a pretty wide opening of this skin barrier, you will have skin exposed to the effluent, and your skin will be damaged by this effluent. Sensitivity to one or more products used on the skin, and this is specifically related on the formulation of the skin barrier. Not all the formulations are for all the patients. So maybe you will need to try one or two different formulations on your ostomy life to be sure that you find the good or the best formulation for your skin, and the one that won't hurt you, and the one that will help you to prevent the peristomal skin complication and not be the responsible of causing a new peristomal skin complication. Also, removing the skin barrier incorrectly or too frequently will cause you specific skin irritation that we on the clinical side call MARSI, that is a medical adhesive related skin irritation. So these MARSIs, these skin irritation due to the adhesive of the medical adhesives, it's totally preventable, but by having a good practices at the moment of removing adhesives from our skin. And needs to be a pretty smooth removal of these adhesives on our skin. We need to press the skin instead of pulling the adhesive from the skin. You need to hold the adhesive, press the skin, and you will then be removing by in a smooth pace your adhesive, and you will prevent of having this adhesive related skin irritation. So the peristomal skin complications range from mild, like this one, to moderate, like this one, with more redness, maybe with pain, maybe with a little bit of broken skin, maybe too itching for the patient. And also, we can also be having patients with severe skin complications like this one. Of course, we don't want this one. And in this case, we will act immediately if we see one of these. But we want you to know that also it's not good to have this one. And it's not good to normalize having skin, just a little redness or just a little itching. It's not good to have a little of anything. Your skin, the skin around your stomach, needs to look like the skin without the stomach near of that skin. So if you want to know how your peristomal skin needs to look around your stomach, just look at the other side of your abdomen, of your belly, and the appearance of that skin needs to be the same appearance on your peristomal skin. If it's not the same, if it's more red, if it's more pain, if it's more itching, that skin, then you have the opportunity to have a better quality of life, to prevent a more severe peristomal skin complications, and to solve this problem and brings you a better quality of life being an ostomy patient. So the causes of the skin irritation, I told you before, the leakage of the effluent underneath the skin barrier of your pouching system, and also the wrong formulation can cause you. But there's another one that I want you to talk you about. So the leakage, we already talk about it, is on the skin adjacent to the stoma, maybe red. It can progress to an open raw skin like this one that you are looking here, or maybe this one that you are looking here. It can be weeping. Some of the patients can experience bleeding, and it can be painful, or just it can be itching. Improperly feeding, as I told you before, the opening in the skin barrier, if it's too large, then stool or urine, if you are a urostomy patient, will be in contact with exposed skin, and of course harming this exposed skin. If it's too small, then you will not have a good adherence of your pouching system to your abdomen, and you will have the problem of needing to remove constantly your pouching system, and this can cause you medical adhesive related skin injury. The pouching system does not adhere well to the abdomen, and then the stomach drainage could leak under your skin abdomen. Yeast infection, this is not always related with leakage and not always related with formulation, but in sometimes we can find that maybe a leakage is the responsible to allow a yeast infection, or maybe a formulation, a specific formulation can be the one that is allowing yeast infection. So it can be due to leakage or excessive moisture on your peristomal skin. The area may be also present with raised and red bumps, like these ones that you can look, a little bumps here on in these areas. And there's the main symptom is intense itching, like one of the most important symptoms of this yeast infection. Of course, this needs to be treated, evaluated, and treated by the WOCN in charge of you. Sensitivity, it's an inflammatory response due to hypersensitivity, sometimes related to the formulation of the skin barrier. Is redness that may be accompanied by blisters. Some of these blisters can bleed sometimes, not always, is not as usual as we can imagine, but it can happen. And the main characteristic of this sensitivity is that it usually mirrors the area of the contact. As you can see on these images, this hypersensitivity area is like a tattoo of the skin barrier that is attaching the pouching system to the skin of the patient. And this skin, the immediate peristomal skin, is not hurt by the adhesive. So here the responsible is the formulation of the adhesive of the pouching system, and we need to change that adhesive, change the formulation for you to have a better skin health. Here also you can look, sometimes the tape surrounding the skin barriers on your pouching system can make this happen. This area of redness, some blisters, maybe pain, maybe itching. It's an area that is like a tattoo of this tape around a skin barrier. So it can be intense itching and difficulty to getting the pouch to adhere. I told you before, too frequent or improper removal of the skin barrier, the skin may be itchy, blister, or open and weeping. It looks like the skin is crying. It looks like moisture skin, but too moisture, and is not a good skin to adhere an adhesive, and it hurts, and you have pain, and maybe you have itching. So you scratch and you have more itching. So it's like a bad circle that you are following if you are having this too frequent or improper removal of the skin barrier. How do we manage this skin irritation? For leakage, our suggestion is to change your pouch right away when it leaks. Don't wait too much to see if it will leak a little more of the, or if it will last you 1 day more. No, it's just the time to change your pouching system. Change your pouch on a regular schedule before it leaks. It's the best to practice before the leakage is the best moment to change your pouching system. Maybe it's not the time that you want your pouching system to last. Maybe you want 5 days to 7 days, and it starts to leak when it's the 3rd or the 4th day. It's better to have a pretty good skin than have a lot of days of using your pouching system. Consider using an ostomy accessory, sometimes rings, sometimes a barrier accessories like I'm telling you here, the rings, the convex rings, the paste can help you to prevent the leakage, mainly on those abdominal creases or those abdominal folds that may be struggling with the adherence of or the good fit of your skin barrier around your stomach. Consider different shapes of barriers, such as flat or convex. If your stomach has a good height, like 1 inch, 1.5 inch high, then a flat skin barrier is good for you. But if the stomach is just at the level of your skin or below the level of your skin, maybe you need something else, like the convexity, for you to have a better fit around your stomach and to prevent this leakage under your skin barrier. Of course, it's better to contact your WOCN to have a good evaluation on this and have the better solution for you. The improperly fitting skin barrier, well, our suggestion is to measure your stomach using a stomach measuring guide before every barrier application. It can be like a measuring guide like this one that you are looking here. We have another ones that are like just half circles, and whatever you have on hand, but be sure that you are measuring your stomach right and you are cutting the opening in the skin barrier in the same size as the stomach. Apply a light dusting of Stoma Powder to moist, in case you have moist skin. If you don't have moist skin, then you will not be benefited by the use of Stoma Powder, and maybe that Stoma Powder used on a skin that doesn't have moisture, then you can lower down the adhesive properties of the skin barrier. So always is better to contact your WOCN to have the better evaluation and to bring the better solution for this improperly fitting skin barrier. If you have yeast infection, first of all, contact your WOCN. Maybe you will need to use an antifungal medication, and if the antifungal medication is prescribed to you, be sure to use it in powder form and not as a cream, because if you use it like a cream, then you will lower down the adhesive properties of the skin barrier. And always dry the skin well after showering or bathing, because if you remain with a lot of moist on this skin and you are not sure of drying pretty good the skin, then you can have these yeast infections, and the yeast infection can be more complicated with another skincare peristomal skin complications. If you are experiencing sensitivity, identify and remove the cause of sensitivity. Consult your WOCN, of course, for product needs. Apply Stoma Powder to manage excess moisture. And I told you before, if there's not moisture on your peristomal skin, then you don't need to use any more Stoma Powder. Check your pouching system to be sure that the size of the skin barrier opening is the correct one, is the right one, and check your change frequency. Maybe you will need to make the change 1 day before to be sure that you are not experiencing sensitivity. If you have too frequent or improper removal of skin barrier, our suggestion is to try a pouching system without tape. Support the skin during removal, as I told you before. Apply Stoma Powder to open skin before applying the new pouching system. I told you before, if it's not moisture on your skin, then stop using Stoma Powder, and of course, contact your WOCN. I will make a summary on how to make a good practice ostomy pouch change, just for you to remind those steps that need to happen for you to be sure that you are making your ostomy pouch change correctly, and maybe find out that there's a gap that you can take advantage on, and maybe with that gap and making a change on this gap, you will have a better skin health on your ostomy pouch change. So first of all, be sure to collect all the supplies that you will need, your sizing guide, maybe if you need some accessories. If your pouching system needs a clamp, be sure to have the clamp, and not take you for surprise that where is the clamp, and maybe everything is going to be wrong if you don't find the clamp. Be sure to have a collection bag to dispatch the previous pouching system that you're removing. If you are using a two-piece pouching system, be sure to have the correct two parts of the pouching system, that the flange is the right one on the skin barrier and on the pouch. And of course, have your scissors ready and your pen ready to have a good sizing, a good measuring, and a good cutting of your ostomy skin barrier. First of all, remove the used pouching system. We recommend you to make it from top to bottom. And why is that? Because if in the moment that you are removing the pouching system, the stoma starts to work, start to take out effluent, take out stool, take out urine, then you will be sure that this urine, that this stool will go directly to this older pouching system, and not will be a mess on the place that you are changing your pouching system. The recommendation to remove the adhesive is the same that I told you before. Push your skin, remain stable the adhesive, and then be sure that pushing your skin starts to remove the adhesive and not hurting your skin. After you remove the former pouching system, clean and dry the skin. We recommend to do this just with warm water, clean water. That's good enough to clean your skin. You won't need soaps. But if you feel comfortable using soap, just be sure that these soaps are neutral on pH, and that you remove all of the soap residues, to be sure that the soap doesn't hurt you more than the little help that it can bring to you. If you are changing a pouching system to a little one, to a kid, to a baby, then you don't need to use soap, because the soap can be too harmful for the skin of these people, the little people. Inspect your stomach and the surrounding skin condition. Be sure that you don't have skin irritation. And if you have skin irritation, identify it. And if you are able to, contact your WOCN to have a good evaluation and a good solution for that skin irritation. Measure your stoma, as I told you before, with a measuring sizing guide. You can use this one. You can use the other one of half circles that I told you before. Or maybe you can use just a ruler, a good ruler, to measure your stoma, and be sure that you are cutting your pouching ostomy skin barrier on the proper size that you have. The options on sizing using the measuring guide. The skin barrier should fit where the skin and stoma meet. Just this side. On this specific side is where you need to cut the skin barrier, and the opening should be the same shape as the stoma. If you have a round stoma, then a round opening is good enough. But if you have an oval or a irregular stoma in shape, then you will have this, you will need the same shape on your skin barrier to be sure that you have a good fitting. Trace the barrier side of opening on the back of the skin barrier before removing the adhesive protection. Then cut the skin barrier opening to the size that you already traced. And finally, remove the release film of the release paper. Once that you have removed this paper or this film, close the pouch. If you need a clamp, if it's an integrated closure, or if it's a tab in the case of a urostomy, or if you have like a closed pouch, then you won't need to close anymore. You are just ready to go and put on your new pouching system. If you need accessories, this is the moment to use those as accessories, specific the skin barrier accessories, like the paste, like in this picture, or like the rings on this picture. Is the right moment to use them, to apply them directly to the skin barrier, and then you will be ready to apply the skin barrier. We recommend to remain the pressure on the appliance of your skin barrier, remain that smooth pressure, like 30 seconds, maybe 60 seconds, for you to be sure that the adherence is good enough, and then the hydrocolloid on the skin barrier is pretty good adhered to your peristomal skin. If it's a two-piece pouching system, it's the moment to attach the product. Remember that this attaching system can be performed without pressing your abdomen. So take advantage of this kind of attaching systems to be sure that you are not hurting your abdomen pressing it a lot. If you have a urostomy and you want to have a bigger or larger amount of collection, you can connect a bedside drainage collector to your urostomy pouch. If you need to use Stoma Powder, or you're prescribed with Stoma Powder, the right way to use it is to apply it directly to the moist skin. And after apply it, be sure to remove the dry powder that remains there. Because if you don't remove that dry powder, then that dry powder will be struggling with the adherence of your skin barrier, and maybe you will experience a lower time of use on your skin barrier. And remember, don't ignore skin problems around the stomach. Do seek help for skin irritation or pouch leakage, and don't use home remedies. There are a lot of home remedies. I don't know if you on the United States, but here in Mexico, people can use as much as home remedies that you can imagine. The people put on their skin honey, or put on their skin something called benjui, some things that can be more harmful to your skin than really a benefit for your skin. Always contact your WOCN. They will have the better solution for you. They will have a good evaluation of your skin irritation, and they will be sure to bring you the best solution possible for your skin issues on that moment. I will share with you this video for you to, if I can, I cannot. Let me see how can I do that. No. Visible. Okay, I will share with you this video just for you remember that skin health is important. It's an acronym for health that we are using for you to remember that skin health is good to have, is the only way to have an ostomy. If your skin is not healthy, then you have the opportunity to improve your quality of life, to lower down the amount of money that you're expending on taking care of your ostomy, and the opportunity to have a better quality of life on your ostomy life. I don't know, I mean, maybe you won't hear, but it's just music. I will lead you through the video. The acronym is healthy skin, always healthy skin. It will help you to maintain quality of life. The E is for easy removal. Remember to have a good removal. You don't need to rush with this. You don't need to just pull it and make it quick because you are afraid of having an accident or maybe making a mess on the bathroom. Take your time to make this removal. Always clean your skin. Water is good enough. You don't need any more. If you want to use soap, be sure to use a neutral pH soap. And remember to don't use soap on little people, on kids or babies. Learn to measure. Be sure that you are measuring properly your stoma on size and on shape. Learn how to measure. It will help you a lot, at least for the first 1 year of you being an ostomy patient. It will be super helpful for you to know how to make a good measure. Be sure to trace it, the template, to ensure the right fit, and be sure that you won't be having leakage that is not skin exposed and that is not too small, the opening, and it can hurt your skin. And always remember, again, help your skin. There's always ways to help your skin. If you are not knowing how to do it, please contact your WOCN. And of course, remember, here in Hollister, we have Secure Start services that are just there for you, not mattering if you are using Hollister or any other brand. We are here for you to help you with this or maybe on other questions on your ostomy life. With this, I finish my presentation. Taking back to you, Tanya.
Thank you, Dr. Minguer. That was very informative. I did want to reinforce very quickly for all the individuals that did just join us that if you do have any questions, you can type it into the chat, which is located at the bottom of the screen, or you can raise your hand and we can unmute your mic and you can go ahead and ask any questions that you may have. I did want to reinforce the crusting technique. I think that's one of the techniques that we do try to teach here before they go home, whether they require it or not, because oftentimes the right way to apply it gets confused. So it's very important to remember to apply the ostomy powder first. You dust off the excess and you seal it in with the skin prep. That's going to help create kind of like a drier surface to be able to apply the pouch without any leakages. You can do that up to 2 times and that will definitely help secure the pouch as much as possible. And one last thing that I did want to mention, another complication that you can have is something called folliculitis. So for many people, abdomens happen to have lots of hair, whether it be for male, female, abdomens do have hair. It's very important, especially to achieve a good seal, to make sure that you trim that hair frequently, whether it be once a week or maybe less frequent, just depends how quickly the hair grows. The reason that it's important to shave the hair is because you can get an infection of the hair follicle from the constant trauma of removing the appliance and the barrier. Not only can you get an infection, but the hair, the longer it is, can prevent a good seal of the appliance, which can create leaking. The best way to trim down the hair is to get some ostomy powder and you lightly dust all the areas around the stoma. And you get an electric shaver. It's better to use an electric shaver than a razor, just to prevent any irritation. Oftentimes, you know, even when you shave your face or your legs, with a razor, you can get irritation. So you can do a dry shave. You just apply some powder and you use an electric razor to trim down the hair. Very important that after you do shave, you clean it with water, like how Dr. Minguer had mentioned. You just want to make sure you remove all the powder and the loose hair that was shaved off. And then you can go ahead and continue with the application of the pouching system, like how you would normally. And that was something that I did want to mention because it is something that we see pretty frequent here. So I did want to mention that. We did get a question in the chat. This is from one of the attendees, that she does have a severe skin irritation, like in the third picture. I'm assuming that it's in the beginning set of slides that you had. And she does use the skin barrier, but she still has it happening. That's a very complex question because we would have to take into consideration many things like the contour of her abdomen, if she has any creases, and even something as simple as seeing what the stoma looks like with you having a seat. There is many people that maybe they apply the skin barrier standing up in the mirror, so it's a nice flat surface, but as soon as they sit down, the stoma may turn into an oval and there may be creases that maybe were not visible standing up. If in this case she has open sores. So it also depends how much drainage is coming from those open sores and how close to the stoma those open sores are, because maybe it's a quick fix, like crusting those open sores if they're not too deep and they're not draining too much, or it might be a little bit more complex, requiring maybe some type of absorbent dressing like an Aquacell AG that has some silver in it and covering it with a Duoderm. So it really depends on how deep and how big those sores are.
That's right.
Awesome. Does anybody else have any other questions regarding skincare? Oh, Steve.
iPad Air 2.
Okay. We're getting to you.
Okay. I wrote it down, so let me read it so I don't forget it. My peristomal skin is pink. It's not red, it's just pink. And I've been using the Hollister wafer 15803 for some time, or for some like 1.5 years. Do you have a less stiff convex wafer? Would that help a little bit of the pinkness? I'm trying to think, well, how can I get rid of the pinkness around the stoma? It's light pink. It's not red or irritated.
And it hurts?
No, not at all. No itching, no pain, nothing.
Maybe it's just changing on skin coloration, just because the constant use. Oh, I can see. Okay.
Oh yeah.
Okay. Maybe there's chance to help you. I would recommend you to go to your WOCN and maybe find if a convexity is what you need, then to be sure that you are using the right convexity. I'm not too used with the code numbers on the United States, but I'm sure that you will have different convexity options on Hollister and also on other brands. There are different convexity options that needs to be evaluated by your WOCN and then prescribed properly for you. But yes, on that skin, I can see the opportunity to have an improvement, maybe.
Yeah, Hollister actually came out with the soft convex, which we actually brought into the hospital, that has worked wonders. I was very fond of it when I first saw it. I remember when I had first applied it, I almost saw the stoma kind of coming up. I was super impressed. But that is an option for you. Maybe the soft convex, it is one of the newer skin barriers that they do have that might help you out as well.
You know the part number?
You don't know the number?
11703.
11703.
That's for 2 1/4. I don't know what size you're using right now.
You were using which number? The 15 what?
We were using, let me turn back my page here.
15803.
15803.
15803. I can hear you, and let me look for it quickly if I can.
Mhm,
Thank you. Thank you, doctor.
definitely. 2 1/4. The one.
2 and 1/4.
2
Yeah,
1/4.
that's
So
right.
you can use the 11703 and it will still be compatible with the bag that you have.
That's right.
Thank you.
Great. Thank
Thank
you
you.
so much. We will
Yes.
try that.
If
Muchas
you want,
gracias.
what
Wow.
later, call, leave a message, and maybe we can order you a sample and we can trial that first.
Okay,
We
that'll
make
be
it.
wonderful.
Miriam has a question.
Miriam Bonnie.
Hi.
Hello, Miriam.
First, I want to say that the nurses at UM changed my life. They're the ones who taught me how to care for my ostomy in a way that no one, not in the Miami Cancer Institute, not when I had my surgery, and I've had a stoma now for 4 years. I'm going on 4 years. However, I have a couple questions. One is, I'm still use the saline to clean around when I change my appliance. It's something that a nurse taught me, and I just buy it. I don't use warm water. I just feel like that cleans it better, and it doesn't irritate my skin at all. My skin is okay. I have a very large peristoma hernia as a result of this, which I hope to finally have repaired this year. And my stoma is very large. In fact, thank God that the nurses there at the University of Miami were able to measure it for me, give me the right devices and everything. Now my skin is fine, but I do have some areas that don't seem to get better, little cracks on some corners, but that's it. The rest of it is okay. And I do that crusting that you said, because it works better than the, what is it called? That little pin that you put the purple stuff on your
Oh,
skin. To help.
marathon.
The marathon doesn't work for me for some reason, but the crusting does. And I have to do a lot. I have to do that. I have to use ostomy paste, and I also use a ring, and then I use other things to hold it because I have a big ball. If I don't do all of these things, my appliance wouldn't hold, but it holds very well because of what you ladies taught me to do. I'm so thankful to you, really, and I appreciate very much being included in this
That's great.
group.
Thank you so much, Miriam.
But
So,
I just, go ahead.
when you mentioned the cracks, something that we did notice is if you are putting skin prep on the skin, all around the peristomal skin, every single time that you change the appliance, we're noticing that it is drying out the skin a lot. So we've actually been explaining to people maybe doing it once a week versus every single time, just to prevent the drying of the skin. I don't know if
Okay.
that's something that will help you. The
Okay.
marathon skin sealant, it is a good tool to have, but it's not for every time use. It's really if the skin's just irritated, because it doesn't allow the skin barrier to properly stick. So if we do use it, it's very minimal application of it.
Right.
And out of curiosity, you are wearing a hernia belt, right?
I do. I wear, well, yes, when I leave the house, I'm not doing it so much at home, which I should. And
Yes.
you're right, I should be doing more, because it does cause a lot of pain in my back, and it limits me from doing a lot of things because I'm exhausted. Because it's a lot of weight. It's like,
It is.
I'm a 59-year-old woman that looks like she has a side pregnancy going on her left side. Not cute, but
It's a good,
Also,
it's the best way to describe it.
well, it really is. It's a side
I know.
pregnancy. It's the weirdest thing, but I mean, I hope to have it repaired, hopefully finally this year.
Hopefully.
And it's just with COVID and everything. I got COVID and I thought I was going to die, and I'm still dealing with long-term symptoms from it. But what about the using the saline to clean around? Is that okay?
I would practice is to just use water.
Okay.
And a low residue paper towel, no toilet paper, no tissue paper.
I use
because it will
gauze
disintegrate.
for, I buy gauze that to take care of everything.
Right. Try making the switch to maybe water and the paper towel, because it's a little softer on the skin as well, just to
Okay.
prevent such harsh things making so much contact to all those little areas that you do have. See if that will
Okay.
help.
Okay.
All right, so we
All
have one more question. When using a ring, is it best to adhere it to the appliance, or to put it on the skin and then attach it, and then attach the appliance? So in my opinion, the best thing to do is to apply the ring, the moldable ring, as close to the stoma as possible. That does help protect the skin all around the stoma, and then apply the skin barrier. What happens is that maybe the skin barrier might be cut just a little bit larger, and you're not getting that good seal all around the stoma. So placing the ring as close as possible to the stoma, I think, is the best approach to prevent the skin irritation. Definitely don't apply it to the back of the skin barrier. All right. Natalie Herman, you have a question.
Okay, can you see me? I don't know if,
I
okay.
see you.
Okay, how you doing? I've been seeing the ostomy nurse quite frequently, because I'm the one that wrote about the redness and the sores, and she gave me, I don't know if you can see, it's a cream.
Oh, an antifungal.
Right, an
But it
antifungal.
has steroids.
You have to wipe it off. So if you wipe it off, what's the purpose? And someone else said to use nystatin powder, which is antifungal. But I'm still having and even the ostomy can't figure out why I'm having all these blisters that are open sores around. I have a urostomy and a colostomy, number one. I have both of them, one on top of the other. You guys scared me when I got out of surgery with that. I said, what did you do to me? You know, I had you want to put eyelashes on where you're supposed to put them. It just seems to come back all the time. It'll heal and it'll come back. And I do change it all often, even though people do say, oh, you can leave it all long. I said, but my ostomy nurse said, every 3 days, change it.
You're right.
And
So
and their answer, the ostomy nurses don't have an ostomy, so they don't know. So
it is right. You should always be changing the barrier, the skin barrier, every 3 to 4 days, because although from the outside everything looks like it's functioning properly, you don't realize that maybe the effluent is undermining until you remove the skin barrier and you look at the back and you see that it's nice and soggy and plump. So that is why you should be changing it every 3 to 4 days. Some people can make it up until the 4th day, but never longer than 4 days should an appliance be left on.
when I take it off, that the Ekin seal is starting to disintegrate.
On the 3rd day?
No, longer than that. I'm going to go back to my 3 days, like I had with Karen Larkin. I'm going back to 3 days.
Okay, good.
But I still keep getting these blisters. She said she doesn't know why it's happening.
The blisters are happening on the urostomy or the colostomy?
It's open sores on the urostomy, not the colostomy, my urostomy.
Okay, and then whenever you do remove the skin barrier, are you noticing that the Ekin is that there's maybe like a lot of moisture back there?
Yes.
The back?
Yes.
Okay, and how long have you?
Well, gooey.
And how long have you been using the skin barrier for?
For quite a while. She had me go from the Hollister to the Ekin, and then I was going to another one that was skinnier, but I couldn't handle it because it stretched too much.
And you do come to our clinic?
I go to Karen Larkin because it's close. I'm all the way in Boynton Beach.
Boynton Beach.
So it's a long schlep for me.
The thing is that it's kind of hard to tell what could be happening without having seen you in person, assessing your abdomen. The best that I can tell you right now is by just take care of those sores, whether it be with crusting, like we mentioned before, with the powder, because you have a urostomy, you are at higher risk for developing fungal or yeast infections.
Right.
So maybe if you notice that it is more fungal-like in nature, you can do the crusting technique with the antifungal powder.
What is the crusting tech? Oh, yeah, okay, right.
With powder, you can even mix the two. If you see that it's a lot of moisture and a component of fungus, it's a little bit of both. You can mix both the antifungal and the ostomy powder. You can mix those together. So at
Okay.
least you're getting medication into the sores, and you are getting something that is absorbing the drainage. So you're getting a mix of both. But definitely powder, then skin sealant, and you can repeat it up to two times.
She had special gauze that had medication, and she would cut it and put it all around it. I forgot what it was. It was a big patch, and you like was in strips. You cut little pieces of it off.
Oh, could it have been Aquacell?
I think, yeah.
Maybe like a gray color absorbent. Yeah, so then your wounds get pretty deep. That is a good technique to have because it has silver in there. So you're fighting infection and you're also applying a treatment to the area. So that is good to put the Aquacell and then secure it in place with a Duoderm. It kind of acts like skin. So at least you're getting a treatment to the sores, and then you can go ahead and apply the appliance without an issue.
Okay, I'll make an appointment again. I'm on a
Yeah,
regular basis with her already.
Yeah. Hey, it's Natalie again.
Karen, it's me again. Yep, same thing. I mean, I go to you an hour and a half.
Can I
Yeah,
talk?
unfortunately, the only clinic that we have here is at UM at the hospital for right now.
No, you don't have it at Deerfield, which would be wonderful.
Maybe soon we'll grow.
Okay.
All right, go ahead, Steve's iPad.
Okay, thank you. I wanted to say one other thing. First of all, I wanted to thank Anna Restrepo. She is by far the most wonderful. I haven't had everybody, but she is the most wonderful nurse there. I mean, she has helped, and we do virtual because we're up north, and we do a Zoom with her, and she looks at my pouching system. I had more redness around, and they thought I should go to a dermatologist, a wound specialist. I'm sorry, an open wound specialist. I had Dr. Kersner down in Miami.
Oh, yes.
Okay. And I showed him a picture of my stoma, and he said, he recommended this, which is, I can't even pronounce it. Can you see it?
Clobetasol.
Okay.
Clobetasol.
I think it's a steroid. He recommended it. We used it. I changed my pouch 3 and 4 days a week. I do every 3 days and then 4 days. I've done that since I've had it. And I've used that, and I started to use it, and boy, for what?
2 weeks.
2 weeks. Boy, did that clear it up. Clear it up? So now Anna said, don't use it all the time, but use it maybe
Only if it gets bad.
only if
That's
it
really
gets
bad.
red. But I just wanted to say, this is what Dr. Kersner had recommended. And it
Can you
worked
hold it up again?
wonderful. What?
Can you hold it
Oh.
up again?
Well, you have to get a prescription for
It's a
it.
script.
It's
No,
a
don't-
script,
With some bit. I know, yeah. Right. Okay.
okay?
Yeah.
So that was my experience. So I just wanted to let you know. And, it was very.
It's good to
Good.
know that she does a Zoom. I didn't know she does it by Zoom, Anna.
Yes, we have
Only
telehealth.
Only
That's nice.
because I'm up north. Only because I'm up north. I can't be there. If I was there, I would go right to Miami, but I happen to be up north. So she did say she would do it. I mean, I don't see her every week or it's every couple of months.
4 months.
Yeah, 4 months. I mean, so, but anyway, she is wonderful.
Cheers.
I'll let you know.
We do have the telehealth option because, for instance, like you, Natalie, that you do live far, it is an option. There are people that aren't physically able to come to the hospital, so it is an alternative to at least be able to get the benefits of seeing a WOCN in the comfort of your own home. Of course, we always do try at least one initial visit to do in person to get a better understanding of, you know, the ostomate as a whole, to check out the abdomen and different types of things that could probably affect the pouching. But yes, telehealth, it is an option here.
I have to tell you, the services are wonderful. I do all the cancer support services, and you guys are wonderful.
Thank you.
It's what you guys are really great.
Awesome.
If I had to recommend someone having double ostomy, I'd say have it by you.
Okay, so there,
I want to interrupt for a minute. This is Anna. I just wanted to just chime in.
How do I get the information about doing a Zoom with Anna?
We can't hear you, Anna.
Anna? Your slides were wonderful. I clicked on every single one. I won't sell them though, I promise you, I won't make money on it. I'll put it in the chat for Anna.
were you guys able to hear her? No, they weren't able to hear you. How, so there's one more question. How can we make contact with Anna for a Zoom meeting? You can always go ahead and call the office and we can go ahead and schedule you for an appointment. Or if you're already an existing patient at UM, you won't require a script, but if you are from an outside hospital, then you may require a script, but that's always easy to obtain. You just go to your primary and they will give you one.
Okay.
Okay.
Good
Is
to
there
know.
any other questions?
Keep smiling. I like that.
My face hurts already. Awesome. All right. So I did have a very quick announcement. I know we're running very short on time. I did want to mention that if you or anyone you know feels like though they would benefit from a Spanish ostomy support group, we do have one that will take place on April 19th at 6 p.m. Eastern time. So please mark your calendars and spread the word. We will have Mario Munoz. He is a general surgeon who will be discussing peristomal hernias. For the following English ostomy support group, which will be held on May 3rd at 6 p.m. Eastern time, we will have Maria Jose Bowie. She will be speaking on traveling with an ostomy and give wonderful tips on how to vacation. And it's perfect timing because summer is approaching and I'm sure there is many vacations that are being planned. And an ostomy should definitely not stop you from traveling comfortably. There is going to be lots of great information, so please do not miss out. And if you would like to be reminded about the meetings, please write your email in the chat room and we will make sure to send you a reminder. Or you can go onto our website at umiamihealth.org and click on the Ostomy Support Groups tabs and you will see all the upcoming meetings. And I have one more request. If you can please go ahead and type in the chat, maybe another topic you are interested in hearing in one of the support groups, please go ahead and do so. We will try our best to accommodate all the topics. I do want to thank Dr. Minguer for taking his time and giving us a wonderful presentation on peristomal complications. It is something that is very common and you did a wonderful job. So thank you again.
Thank you. Thank you.
Thank you. All right. So I do hope to see you all in the next ostomy support group. Have a great evening.